normally after the baby starts breathing, this thing just turns into a ligament. But in fetal circulation, this thing is actually taking blood from the pulmonary artery and putting it right into the aorta. So, like I said, after the, this little narrowing here, this where that insertion point occurs usually determines whether or not the kid's going to live or not. Okay, but again, this is a right to left shunt. Okay.
So if that doesn't close up, there will be venous blood mixing with arterial blood?
Yeah, and the baby will be clubbing. The kids will be stenotic. They'll have what they call clubbing of the fingers. The clubbing means that they have like flat fingertips. Okay. I put this in here, rheumatic heart disease, because remember I told you that if a person has rheumatic heart disease, this is the valve, and this is all scar tissue and damage. So this thing, it's either going to be constantly open, so every time the heart contracts, blood's going to go backwards. Okay, the valve doesn't work. So typically you get a very high ejection fraction if you're doing a MUGA study. Like I said, anytime you get a high ejection fraction, you better stop and find out what the heck's going on. Don't just turn it in, because the doctor's not going to have any credibility in you if you don't investigate why. So if you say, well, the patient may have a mitral valve stenosis or mitral regurgitation, okay, now you got something. Okay, that's why the ejection fraction is high. Okay. Anyway, I put down here, anytime you have rheumatic heart disease and stuff like that, all sorts of problems occur. A lot of times they have to go in and replace the valve.
How high would that ejection fraction have to be for you to suspect something?
I get concerned anything over like 65. Yeah, if you put that thing on automatic processing, you really got to watch it. I've seen it where the computer is going to look for the highest amount of activity. And typically that's either going to be the superior vena cava or the ventricle. Okay? Ideally it goes for the ventricle, but the thing is that if it goes for the superior vena cava and you're not watching it, you're screwed. And then this is the other thing here. Now, I put bacterial endocarditis in here. This is a little bit different, but if you're doing a gallium scan or a white blood cell scan, sometimes you have a fever of unknown origin, or you have stuff going on that they don't understand. And that's why I said the bacterial endocarditis, the subacute can take a very long time to develop. Notice I put down strep viridans. If you have dental work done, then a lot of times the dentist will put you on a course of antibiotics before they do anything. If you've had any kind of heart problems, they'll typically put you on that. The acute one, you do not want this one. This one usually occurs because you develop septicemia. Like maybe, you remember how your mom told you not to pick your pimples? Okay, if you get that stuff into your bloodstream and you develop septicemia, if it's Staph aureus, which most of your skin lesions are, you're looking at if you do get acute bacterial endocarditis, 60% die.
Whoa.
Yeah, so don't pick those pimples. Yeah, the subacute is more common. I just thought I'd show you. These are the colonies of bacteria that are growing on the valve. If that doesn't scare you, then show that to your kids the next time they want to start picking their pimples. Okay. Okay. The arteriosclerotic heart disease, remember we said, well, first of all, it usually starts out with fat. That's atherosclerosis. When it gets calcified and hardened, then it's arteriosclerotic. There's a number of things that can cause arteriosclerosis. Atherosclerosis is just one of them. So anyway, as the blood vessel gets narrow, the pressure continues to increase, and so blood doesn't go through. It takes more pressure to push it. We already talked about this. Etiology. Okay. What I am going to be concerned with, though, and also on my list, are the coronary arteries, because this is what we're actually looking at when we do our heart studies. I don't remember if they had it listed in here. I don't think they did.
Yeah. How's the schedule
Well, today you guys get out of here at noon, and we won't, we have the long day on the 18th, and I think the 25th.
That's it.
Terry, that's the 2 long days, right?
I sent an email out to everybody this morning.
Okay, anyway, I'm gonna send this to you, and I'd like you, make sure you know those. And when you're at the hospital,
We're done.
you're done for the day. Unless, I'll stay. If you guys wanna stay here longer, I'll do that.
Please.
Terry